You're tuning in to another.
Yeah, too close up.
Oh,
So just like right here.
okay.
And back.
Hey everyone, you're tuning in to another episode of On Social with Nikki Nicole. Today is a special episode. Here with me today is my doctor, Dr. Thomas Locke with the Wise Medical Center. How you doing, Dr. Locke?
I'm well, thank you.
I just want to say to all of you all, I am so appreciative of Dr. Locke. He is one of our major sponsors for the Power Pink Breast Cancer Awareness event. And I just want to personally say thank you so much for this opportunity to interview you, because I know he's a busy man. I've been trying to get him on my show for a long time.
Well, thank you for the opportunity.
So all of you all who have been asking, like, Nicole, how do you get snatched?
Uh-oh.
Yeah, they've been asking, like, how do you get
Sure
snatched?
you want your secrets told?
I'm gonna unfold my secrets. I tell them anyway, Dr. Locke. This is the doctor who actually performed my procedure, my surgical procedure. That was my upper quads, lower. He gonna tell you what he did to me. He made me look good, and I am addicted, and I am coming back. Listen, ladies, this thing is an addictive. I am gonna be just like Dolly Parton. I just want to just tuck and suck, and I'm sorry. And that's the thing now. Mm-hmm. Like, we're in this new Atlanta is like Hollywood, but everybody's so focused on image. So you are in a great field. I've just devoted myself to help Dr. Locke because I just wanted to promote him in so many ways. And he knows I've sent him so many people, right?
You haven't. We're most grateful. Thank you.
And they don't be wanting people to know they came.
Oh.
They don't be wanting people to know they came, but that's okay, because at the end of the day, this is a great way to enhance your look safely, healthy, as well as Dr. Locke is an expert in this. So thank you so much for being on the show.
My pleasure. Thank you for having me.
Dr. Locke, I just want to say, as you can see, we're in his new location. It is gorgeous, you all. He's located right in Johns Creek. This is the second location, right off the highway. Very easy, very convenient, ladies, to get here. And look at his office. It's so nice. So, Dr. Locke.
Yes.
So, what I want to say is, let's just kind of clear the air for a lot of the ladies who are a little skeptical.
Well, we provide what we refer to as personal image enhancing services.
Yes.
So we emphasize things that are maximally beneficial and minimally invasive.
Minimally, ladies.
Okay. So, yes, sometimes we have to do a minor surgical kind of thing to get fat out. But a lot of times we have non-invasive techniques that we use as well. And more often we complement things like liposuction with the non-invasive procedures, and the two together work even better.
Yeah, so let me tell y'all about that, ladies. He sculptors. When I say sculptor, that means he cuts out and carve you some curves. If you don't have some curves, Dr. Locke can give you some curves. What I love about him, so a lot of them, like the ladies be saying, oh, Nicole, I put my pictures on Facebook. I put up things on Instagram. People say, what do you do? You're so snatched. And when I came in today, I told Dr. Locke, and I'm just going to tell y'all, I still wear my suit. It's crazy. I'm addicted to it. It gives me my curves, and I work out in it because it lets you know you're gaining weight. Mm-hmm. It also lets you know, as well as too, when you put your clothes on, it makes it very smooth. So the surgery goes far beyond just losing the weight. It's also maintaining the weight.
Yes. We help with the awareness of what a few pounds can do. And when we combine the minimally invasive liposuction procedure, especially with the various technologies that we use, the improvement in your appearance is disproportionate to any actual amount of pounds that you might lose. And we've calculated, just kind of based on dress sizes and feedback from patients over the years, that for every 12 pounds you actually lose, when you combine it with a minimally invasive body contouring procedure, your appearance will improve as if you had lost more than 20 pounds.
Yes, because when I first had my surgery, I think I lost like 18 pounds, and everybody thought I lost like 30, 40 pounds, and I'm saying, really, it just showed off the work. It just made everything that Dr. Locke did, it enhanced what he did. So, ladies, I'm going to say this. and I'm always talking to the ladies because this is the ladies thing, but men can also
treat
have
guys too.
Yeah, because I've referred some men here. Yeah, y'all haven't referred some men, but ladies, it's not a quick fix. Dr. Locke is gonna tell you still have to eat healthy. You still have to do diet and exercise. Dr. Locke, I work out twice a day. I get on that treadmill twice a day.
Good for you.
I am. I do. I get on the treadmill twice a day, and I am doing some of the things that he told me to do as well. So it's not a quick fix. So let's talk about quick fixes, Dr. Locke.
Well, we also think of it as a jump start.
A jump start.
Sometimes you need to be motivated to make the lifestyle changes, to change your eating habits, to do the things that you need to do to maintain. But if you just see the clothes you already have fitting a little better, or if you can get into something that you couldn't get into before by virtue of what we've done to the inches, then it's more of a motivational tool to help you work on the pounds.
Yes, honey, it's a beautiful thing when you can get into something that you couldn't wear before. And it fits a little different than before because now it shows off all of your curves.
Well, we remove it from where you don't want it and leave it where you do want it.
Yeah,
and
so
sometimes rearrange it.
Yes, he can rearrange it, ladies. He can rearrange it. Now let's talk about, because I know a lot of ladies want to talk about the butt enhancements.
Yes.
Okay. A lot of people don't know he transfers fat. It's not like implants, because I know a lot of people think, oh, that's a fake booty. It's implants. What I like about Dr. Locke, he gonna tell you whether or not you need a booty or not, y'all. He told me, Nicole, you don't need a booty. I wanted a booty. He said, Nicole, no, you already got a booty. What we're gonna do is do this. That's what I like about Dr. Locke, because some doctors will just give it to you and make you look a little bit deformed. Dr. Locke is gonna give you a natural curve. Well, he gave me an extreme waistline.
Well, what I refer to it as hip flattering by waist reduction.
Waist reduction.
You reduce the waistline, you flatter the hips you already have. And, I always use the analogy, you can put lard on the side of a tree, but that doesn't make it a shapely woman. You need that narrow little in the middle, as they say.
Yep.
And you need to have, the breasts enhanced. You need the buttocks reshaped. They don't have to be gaudy and ridiculously enlarged, but a woman's supposed to have some hips. So
we're supposed to have
if it
hips.
need a little bit of help in that department, that's no problem.
And that's what I like about Dr. Locke. He takes your own natural physique and he changes. So a lot of people, when they say, Nicole, I don't look like you did, or I didn't lose as much, everybody's body is different. So when you look at other people, you can't say, well, I want to look like.
Right. No, that's a bad idea. We can't change your musculoskeletal system.
Can't change it.
Your frame is your frame, so we can help you to improve what you're starting with. We can't change the basic raw materials.
You can't change that, ladies. Now, what I want to ask Dr. Locke is a question that I know a lot of ladies are doing right now is the gastric bypass as well as the lap band, which we don't talk against it. I just want people to know that there are other options out there that they can actually do. What is your take on that?
Well, I don't denounce the lap band or the surgical procedures for severe obesity. There's a lot of proper criteria that you have to meet in order to be a candidate for those. So hopefully we can work on people's appearance before they meet the criteria for getting the surgical procedures for obesity per se. But you have to understand that the surgical procedures for obesity are focused on reducing pounds, reducing calories. It has lots of nutritional implications. And the challenge there is they're not really designed to focus on appearance. So you still need the aesthetic input and the cosmetic input to achieve your ultimate goals, even after you've lost the pounds using the lap band or the gastric bypass or whatever. And some of the gastric bypass is a lot less common than once upon a time, but the lap band and all those other procedures now have become a lot safer. So I am a little more supportive of appropriate candidates.
Okay, appropriate candidates.
Having those procedures. But the truth is, we can achieve very similar results with medically supervised weight loss programs. And we can achieve a lot better maintenance if we keep people in those programs for a long period of time. You can't just do it all in one fell swoop. Rome was not built in a day. Regardless of which approach you take, there has to be some emphasis on maintenance, after you reach the point you want to be.
And when he say maintenance, ladies, it's just like a hairdo. When you go to the shop and get your hair fixed, or you go to the beauty salon, the beautician or the stylist does not go home with you. They give you maintenance treatment that you have to do to maintain that style to look the same way. And it's the same way with your body. You have to protect your investment by being able to interject all of the maintenance issues that go along with it. The reason why I'm saying it is because, and I was telling Dr. Locke, I advocate for him all the time. I'm always talking about, because when people ask me, I'm always saying, go to Dr. Locke. And then I kind of wrestled in a conversation with someone about the black man versus the lipo. And they were like, why would I need to get lipo? And I was like, well, you know what? I beg to differ, because number one, this lady was not a really...
Let me address that.
Okay.
I like to think of liposuction as a tool to reduce inches. Okay. The surgical procedures for obesity are designed to reduce pounds. Okay. The two are not mutually exclusive. Some people are big enough that they really could benefit from the surgical procedure, so I don't want to knock it.
Okay.
But there's a lot of people who want to improve their appearance, who have a few inches here and a few inches there. Those are the more appropriate candidates for liposuction. Now, traditional teaching states that liposuction is not supposed to be used as a treatment for obesity. I take the opposite stance. I believe that once you make people understand that they do have to make some lifestyle changes regardless, then liposuction can be a tool, but one of many used in the achieving your long-term goals. But in and of itself, as a sole method of treatment, it's not going to happen.
Well, you hear that, like, it's not going to happen.
We want you to work on the pounds. I work on the inches, and that's a nice 1-2 punch.
Yeah. And what we talked about before we got on camera is that a lot of people still come to Dr. Locke for the procedure after they've already had a lap band surgical to remove the skin.
Yes.
Let's talk about that.
Well, even after you've reduced the pounds, the surgical procedures have an impact on your overall nutrition such that frequently they leave you with a lot of loose skin. Mm-hmm. And then you get into the more reconstructive procedures that we sometimes refer out to our colleagues in the plastic surgery arena, or sometimes with some of our technologies, with radio frequency, lasers, and other methodologies, you can reduce loose skin sometimes without having to remove it. Okay. So it's an individual matter. It has to be tailored to the specific patient.
Okay.
And what's true for one would not necessarily be true for the next person. Yeah. So some people truly do need the more aggressive removal of large amounts of skin. Mm-hmm. Some people, even after lap band procedures, can benefit from the minimally invasive procedures or even non-invasive procedures and get sufficient improvement in loose skin to not require the downtime that comes with the big abdominoplasties and all those other procedures.
Yeah. I thought it was a need to do this show with Dr. Locke, not just because we love Dr. Locke, but also we wanted to put the awareness out about being healthy. Eating right, interjecting exercise into your everyday living. It's a struggle. The struggle is real. Obesity is one of the number one things in America that kills people every day, and it's not so much of the obesity, but it's the health reasons, the health facts about the consequences about high blood pressure, diabetes, all of the things. Like, we're literally eating ourselves to death. Literally eating ourselves to death. And as women, we love our image. It's your first impression is your image, your face, your body, and we live in a society today where image sells, the body sells. It's just crazy because it's what we see on TV. It's what we see on social media. But the way that we're thinking about it, ladies, is not as invasive as you would think. It's I'm not gonna say it's painless, The
There's some
pain,
discomfort.
it's discomfort. No, it's the pain part is the maintenance. The easy part is going on the table, getting it, because ladies, you're woke, you're not asleep, you're not. Let's talk about the difference in the smart lipo versus the regular lipo, I guess.
Well, Smart Lipo is a brand
Okay.
of laser lipo, if you will. Liposuction is sometimes enhanced by various technologies. We use 3 different technologies I can get into if you like. But the bottom line is we use a tumescent anesthesia with sedation.
That's what I got.
And when you have either oral or IV or sometimes both sedation, your anxiety levels reduced enough that you're not afraid. And we can handle the actual pain with anesthetics. The lidocaine's good stuff.
Yeah, that's some good stuff.
But it gets rid of all the hurt, but it doesn't get rid of the vibration sensation. It doesn't get rid of your awareness of temperature, the pressure. So I can't keep it a secret in terms of where we're working at any given moment. But bottom line is we give you enough of the anesthetic that it doesn't hurt.
It doesn't hurt. You are very aware, because when Dr. Locke is sculpting, he tells you to turn a certain way and lift this up and change. So you're actually being able to tell if something hurt. He'll ask you, hey, do you feel this? You're able to tell him when the discomfort comes, but being asleep.
Yeah, well, it also can achieve better results. When you're working with straight instruments, making curves. You know, there's things you can accomplish by repositioning the patient that can't be accomplished if they're asleep.
Yeah.
So that's a major benefit in working with a sedated rather than anesthetized patient.
So it's so painless, ladies. Listen, I really would tell you to please, come in, get a consultation, see exactly what you could change on your body. Dr. Locke, could you please tell them what all do you actually do? I know you do a lot of the lipo on the stomach, the upper quads, the lower quads, the flanks. Ladies, you got to get your flanks did.
Yeah. Yeah, pretty much anything between the chin and the knees. Different approaches, of course, but you can reduce the chin, we can reduce the arms, we can reduce the brow rolls, we can work on the love handles.
He has it
the
all.
thighs, knees. It's different. People have unwanted, isolated, well-defined deposits is what we look for. And if by removing it, it can improve your appearance, we work on it. Some areas, some fat is not accessible with liposuction cannulas.
Yeah.
So
I had to learn that.
That's when we put you into the weight loss program and we talk about pounds and not inches.
Yeah.
So it's all important. And it's hard to separate, where one becomes as important as the other because they're so intimately connected. But we lump it all together by calling it personal image enhancing services. And for, older women, it sometimes even means a little bit of adjustment in your hormones.
Yeah.
With people who've had ongoing medical problems, sometimes a little extra skin care, from an esthetician is necessary. The wrinkles start to make you look a little older. Sometimes there's simple things like you've heard of Botox and the Restylane and the hyaluronic acid fillers. All those things are just as important as getting on that treadmill every day.
Yes, it is.
So
it's
we like to promote all the things that are important in enhancing one's personal image.
I'm telling y'all, ladies, he is the best thing since sliced bread. I'm telling you. I know the results that Dr. Locke gives. Everywhere I go, someone is asking me, especially the people that know me. People that don't know me, they say, oh, you're so smooth. You're so... Like, Dr. Locke? Like, you need to go see Dr. Locke? Like, he's local. And the thing about what I like about it, ladies, it's affordable now. Everybody thinks it's so expensive to actually have these type of procedures, which some of them are expensive depending on what you want. So when people ask me, how much does it cost? I never quote a price because I don't know what you're going to want when you get there, because you may want to take out something that I want to keep. Dr. Locke, we said we got to get them thighs. Nicole, I be saying, Dr. Locke, they paying for that now. But so some people may want to take away thighs. Why some people want to put thighs, some people may want to take butt. Why do people want to put butt? So it's just different when you know what you want to have look when you take off your clothes, and Dr. Locke can make it happen. So ladies, make sure that how can they follow you, Dr. Locke?
Well, we are right here at Wise Medical Center,
Wise Medical
Johns Creek and Alpharetta. Website is wisemedicalcenter.com.
Okay. And he's on Facebook, because I be Facebooking him.
I get informed about that.
Yes, he gets Facebook. I Facebook Dr. Locke. Yes. So make sure that you reach out to him. It's easy procedure. Come in, it's, painless, and just come in and just have a consultation and see. Summer, it's finna get cold now, but maintenance can go the whole 6 months while it's cold. So when it start back getting hot and we start sharing out the clothes, ladies, it's time to get fine, and Dr. Locke can make you fine. So I'm so glad that you
coming into the colder months is a good time.
Yeah, colder months are good. That was when I first had my surgery.
Mm-hmm.
I had my surgery like around my birthday time. So when May came, everybody thought you just looked like it just lost weight, but I was doing everything during the course of the time. And one thing I can say about Dr. Locke, he made me lose 8 pounds before I did it.
That's right. You got to show that commitment.
Yeah.
If you're committed to the weight loss part, then it makes more sense to do the surgical part.
It sure does.
I like to get a good faith, that's your investment.
Yeah.
So we don't want to take your money if you're not committed to the task. So we do frequently, when people are above a certain weight, actually require that, and we'll help you.
Yeah.
That you lose a certain amount before we even do the first of what sometimes is more than one procedure.
Because if you're not committed to the whole thing, you're not gonna be pleased with the results, because you're not gonna want to maintain it, and it's gonna have to be maintained. Mm-hmm. I learned that it's not a quick fix.
Nope.
It is a lifetime journey, and it is a lifestyle approach. So, Dr. Locke, I appreciate you so much for coming on the show.
Thank you for
I
the
definitely
opportunity.
would love for you to come back be on the show, so we can talk about some other things as well. When
Sure.
it comes to enhancement, there's so many new things that are coming out now, and the good thing about it, that I love about it, is that you're willing to tell it, because this is the way. Awareness is the way, and education is the way to actually show you exactly there's other ways that you can interject in your everyday lifestyle of maintain and maintenance of your imaging, ladies. So make sure that you follow Dr. Locke. Call Dr. Locke if you want to come in. Call me. I'll get you in contact with Dr. Locke. Nope. Really quick. Won't I, Dr. Locke?
Absolutely. We'll take care of you.
So thank you all so much for tuning in again on Social with Nikki Nicole. Again, thank you so much, Dr. Locke, for being a sponsor for the Power of Pink Breast Cancer Awareness. Thank you so much for believing in me, the Nicole King brand. When I first met Dr. Locke, I told him about all of this, and he said, Nicole, I'll come on your show.
I'm happy to do it.
And look at what we're doing now. So again, everyone, stay tuned and make sure you follow Dr. Locke. Thank you so much, and we'll see you next time.